Hi, I'm Nancy Smith, physician assistant at Mountain Medical Injury and Pain Professionals, and today we are going to help this patient feel better because he has had a motor vehicle accident in which he has a hyperextension, hyperflexion neck injury, and also this has caused some occipital neuralgia, which is causing him to have a daily headache. This injection is a choice we can use to help to decrease his headache pain first with an occipital block, which will put an anesthetic and an anti-inflammatory in the greater and lesser occipital nerve, which will cause that to be less reactive and allow him to not have a headache every day when his muscles start to tighten and squeeze that nerve. He will also have some trigger points injected down through the side of his neck, or the cervical area as we call it, because these have had vascular tears in them during his hyperextension flexion injury, and now every time he moves his neck, they spasm and cause him to have pain that radiates down into his shoulder or his back. That is the definition, actually, of a trigger point, when movement or touch at one location causes radiation of pain to radiate to another area. What we will do is also inject each of those trigger points, which we're going to mark now, and we will use a needle to kind of allow them to relax and reset. These will also have a combination of an anesthetic, which is going to, so to speak, turn the light switch off for the nerves and let them calm down. And then by the time that wears off in about 6 hours, an anti-inflammatory will start to work and allow the muscles to relax and let his neck return to normal anatomic position so that he can begin to heal without so much inflammation and pain. So I'm going to first mark the areas that we're going to inject. The first injection is going to be the occipital block, and we do that by feeling the nuchal ridge. There's a small notch in it at the base of the skull, right about there, and that is over skull completely. So there's no possibility of going beyond the bone and into the brain, but it is, the nerves run right through that notch, and we can go in deep and get to the greater occipital, and then back off a little and get the lesser occipital without much risk of any problems at all, and hopefully a lot of pain relief. And as you can see, he's actually got visible hyperemia right there and a little bit of inflammation, and it's tender when I touch. Then, down in his neck, one of the first clues that you have a small muscle tear is that there's going to be erythema. Erythema is the redness here. So when I touch, I don't even have to really palpate the knot because I can see that a lot of blood is rushing to that area where there was an injury or a torn muscle. And we can see another one right here. I'm getting them, aren't I? And right there, right? It helps to have feedback from the patient because he, of course, can feel when these radiate elsewhere and how painful they are. So if I'm touching something that is causing a lot of pain, just let me know. That's one right there, huh? Mm-hmm. There too, right? Mm-hmm. So this can be approached in a few different ways. Some people will use one entry point and then move the needle to hit multiple areas to decrease the spasming from the trigger points. I choose to use a very fine 30 gauge needle to go into each one of these areas so as to have less tenderness after the procedure. And then over here, are you having any?
Up here.
Oh, also there?
Yeah, there you go. Right there.
Okay. So that is the other occipital. So that means bilaterally we're going to do those. This one is far more tender though, isn't it?
Mm-hmm.
Yeah. All right.
This one has greater pain than this one, but this.
Oh, really?
Yeah, but when you go down, nothing else hurts.
Oh, when I push this? Okay, got it. So, first I'm going to do a sterile prep for him as close as we can get in a clinic with triple wipe with Physohex to make sure we don't have any bacteria or germs there. Then, just relax and breathe. We're going to just start with the occipital block, going to the greater occipital nerve, and you should feel a pressure and kind of a sensation of fullness.
Yes.
By the time I get done, it should be numb. And you should be starting to have some relief. Takes just a minute for that medication to absorb. And what you're going to be doing when you go home is today you're going to probably not have any pain because these are going to be anesthetized. But despite that, you're going to put ice on for about 20 minutes, every hour if you have the time to do that, to keep the inflammation down. And you're going to rest and not overdo it because with these anesthetized, you won't feel the pain and you could aggravate them by moving your neck too quickly or doing vigorous activities. So you're just going to rest. So, all right. By the time we get done with the other side and the triggers, that's going to be feeling much, much better. Now we're going to move on to doing the other one. This one's not going to be nearly as bad because it wasn't nearly as tender, was it? All right. And using a fresh needle for each injection so that we make sure to not have any spreading of bacteria from one side to the other, which there shouldn't be because we cleaned it. Okay, this is not so bad. I think you're going to be fine here. We're going to start with this trigger point right here. And then we're going to inspirate just a little to make sure that there's no vessels there, and just a tiny little mixture of anesthetic with anti-inflammatory. Let's see. Yes, I do have that. Then, the next one, with slight movement to try to help that muscle to relax. You okay? Keep breathing. Okay, there we had a little fasciculation, which is a wiggle in the muscle, indicating that it was a little bit tender. Well, we'll just That was really good one. Did you feel that little wiggle in there? The muscle kind of moves, and you can feel it with the tenderness in the area that it was injured. And the last but not least, oh, that was a good one too. And then with just a little bit of massaging to let the medication absorb, you should start to have some relief. How does your occipital area up here feel? You can't feel it? Excellent. That's what we expect for about 6 hours numbness, and then hopefully no more headaches. And that is all.